how long it takes for intradialytic concurrent exercise to make vital changes to the albumin, hemoglobin, and physical function, a time to event analysis. Albumin is the major component of plasma proteins that are essential for maintaining plasma colloidal osmotic pressure. Protein energy wasting, inflammation, volume expansion, renal loss, and loss into the dialysate all contribute to hypoalbuminemia in hemodialysis patients. Hypoalbuminemia is associated with many complications, increased hospitalization rates, and all-cause mortality. Erythrocyte dysfunction in HD patients reduces hemoglobin level defined as anemia. Anemia is one of the most effective factors in causing a variety of cardiovascular diseases in these patients, which eventually leads to an increase in their morbidity and mortality. The high mortality rate of HD patients makes therapeutic interventions to save lives and reduce or limit the complications of dialysis inevitable. Complications of dialysis, combined with forced sedentary lifestyle accompanied by this treatment, reduces physical function in these patients, which is an independent risk factor for mortality of HD patients. So far, there have been some paradoxical studies on the effect of exercise on the albumin and hemoglobin levels in dialysis patients. One reason for this can be the type of exercise as well as the insufficient duration of the previous studies. Now the question is that whether exercise with proper levels of intensity and duration affects the parameters related to survival. And if so, how long does it take for exercise to change these parameters to reach a level that can affect survival? A total of 124 patients participated in this one-center randomized controlled 6-month trial. Inclusion criteria were, and the exclusion criteria were, for the intervention group, 3 sessions of concurrent exercise per week were done in the second hour of dialysis for as long as 60 minutes. As you can see, the events included intradialytic concurrent exercise resulted in a significant positive effect on albumin. The hazard ratio on multivariate analysis in patients of intervention group for reaching the serum albumin to the levels higher than 3.5 grams per deciliter was 8.4 compared to those in the control group. The same positive significant result was observed for hemoglobin and physical function too. This study showed that intradialytic concurrent exercise alone for less than 6 months could cause significant survival affecting changes in patients' serum albumin, hemoglobin, and physical function, and is likely to increase patients' survival. One of the strengths of this study is the use of time-to-event approach. Using this method in clinical research can be a way to answer the question of what type of exercise, with what intensity, and for how long can improve the survival affecting parameters of HD patients. The intradialytic concurrent exercise can be considered as a therapeutic strategy to improve hypoalbuminemia, anemia, and physical function in dialysis patients.